Okay, brief follow-up on the Allergan ALCL textured implant issue from this week. Allergan this week removed their BioCell textured implants from the market in the United States and worldwide. Now, the reason the Allergan BioCell implant is important is because it has shown by far to be the highest of all textured implants in its risk for association with causing a cancer condition, ALCL. The other textured implants, and by the way, again, ALCL has exclusively been associated with textured breast implants. So if you have a smooth breast implant, really we feel there is not any significant risk of developing ALCL. That the Allergan implant is essentially much more likely than a Mentor or a Sientra textured implant to cause ALCL due to the nature of the implant, and we simply also know this because of the data. So the implant's been removed from the market. I have used this implant in a very small number of patients in the past. We've worked to reach out to all of our textured implants patients to give them an update. So the FDA has recommended that if you have any textured implant, that it not be removed. What is the data as to the rate of cancer? Well, the rate of developing ALCL with an Allergan textured implant, again, only textured, is felt to be a lifetime risk today of 1 out of 2,800 patients. The rate of breast cancer in all women not having breast implants, the lifetime risk is 1 in 8 patients, or 350 times more likely than the highest risk textured implant, which is the Allergan BioCell implant. The other textured implants made by Mentor and Sientra are probably 10 to 100 times less risk of stimulating or causing or being associated with ALCL. And our data shows that both in incidence of ALCL and in total number of cases from worldwide and data in the United States. But let's face it, I don't want anyone to be absolutely afraid of something in their body. So even though the risk is dramatically lower than just every woman's risk of breast cancer, if you have an Allergan implant that is a textured implant in place and you want to talk about the possibility of removing it, I'm more than happy to have that discussion with you. My general recommendation, if you're my family member, if you're a friend, a colleague, or a patient, my general recommendation is let's monitor it. There is no urgent need or absolute need to remove that implant, but I'm more than happy to discuss with you the option to remove and replace with a different implant or perform a different type of procedure to simply get rid of that textured implant. At this time, though, we are absolutely willing to take your call and answer your question. We've received many calls this week, and we're simply here. If you have any further questions, you're welcome to reach out to us. At any rate, that's just a brief update. I'm sure there'll be more information we'll be sharing with you if anything new comes out in terms of additional information. But again, breast surgery and all plastic surgery on the elective side is a very personal choice. We very much embrace your choice to work to improve yourself for your personal best, whether it's in your personal life outside of a plastic surgeon's office or if plastic surgery is part of your personal journey. So if you have questions, again, feel free to reach out to us, and we appreciate you following us. We appreciate your feedback and your comments. Thank you.